Welcome to the Experience Better video podcast series. I'm Josh Beekler, PT, and with me today I have Jeff Gossman, a physical therapist here at Grand Island Physical Therapy. So Jeff, we're going to talk about blood flow restriction today. It's something that you perform on a pretty regular basis and an expert in. So tell us what is blood flow restriction?
Essentially, blood flow restriction was actually developed at the VA down in San Antonio. There was actually a lot of limb salvage patients that came back from the war that needed prosthetics, but they actually weren't strong enough to be able to use these prosthetics in a functional setting. So they did some research down there, and they found that if they could occlude your venous return and your arterial blood flow in the limb, you actually get good hypertrophic gains or increase in muscle size. They didn't expect some of the findings they found, which were actually increased growth hormone in the leg and inhibition of myosin. What myosin does is it breaks down protein synthesis, which is responsible for building muscle. That's why you see all these athletes that are eating protein all the time in the big whey jars. So by doing those things, you get really good gains. Essentially what you're doing is putting a tourniquet cuff either on the arm or the leg, and you can do both arms at the same time or one. We use it here at the clinic most commonly in post-operative settings, especially when there's a weight-bearing restriction. Essentially, I tell my patients all the time, it enables us to lift heavy without actually lifting heavy weights. It simulates if they were in the weight room, let's say a high school kid lifting 80% of their 1 rep max, and they're only lifting the weight of their leg. And the beauty of it is I can work them to fatigue or to failure with just their body weight, where before, without this tool, they could sit there and they could do some of the exercises and easily be playing on their phone or something. It wasn't even challenge them at all. And when I was at the course, one of the biggest things they said, if you're really pushing someone how they should be pushed, they shouldn't be able to use their phone. And they actually had a picture of a professional athlete who was on his phone, and as he started to exercise, he quickly put his phone down because it was so strenuous.
This is for real.
But yeah, essentially what we'll do is when you put it on someone, you put it as proximal as you can to that limb, and then we use a Doppler ultrasound, and we're checking your pulse. We're pumping the cuff up till we find a pressure which occludes you 100%. From there, we use a formula and we back that pressure off, and that's the pressure essentially that we operate at. No one's ever in it for more than about 10-15 minutes. Sometimes you do get obviously a little bit of coloration change in the limb, which is completely normal, and it quickly resolves. The first time people kind of give you a look like, is this going to be okay?
Right.
And they actually end up loving it by the time it's done because they can really feel the difference that it makes. So.
Wow. Very cool. So you've been using this for quite a while, and you feel like you've had good results with it. Patients like it. You've seen the results. It's really interesting, especially when you get like a non-weight bearing limb.
Absolutely.
Because one of the fastest ways to atrophy a muscle is to not bear weight through the joint it's going through, because you don't have weight going through that, whether it's your leg or whatever it is. You atrophy so quickly.
And the neat thing too is, you would assume by occluding the blood flow, essentially you would actually have increased swelling. Believe it or not, this actually helps to decrease swelling.
Oh wow!
So that's another big benefit we've seen. If you can get that swelling down, a lot of times, and let's say in the leg, swelling and pain are the two main things that inhibit your quad from firing. Well, if we can reduce both of those by getting the muscle stronger, in turn it kind of is a snowball effect. We're able to decrease inhibition on the quad, which enables them to walk better, have less limp, less pain. So it's just a really good tool, and just another thing to add to the toolbox. So
sure, and the research that we see too is, especially after knee surgery, especially a major knee surgery like a total knee or anything like that, the number one thing that limits people generally is that quad inhibition, is that decrease in strength. So this is a great tool to help overcome that and help strengthen that. So why don't you show us what it looks like on somebody? And keep in mind, I can bench about 400 pounds. So
are you talking squat or bench here?
Neither.
I know. All right. So we'll put it on. We'll put it in as tight as we can, like I said, up in the armpit. With him, we don't know what his pressure would be, but if I was doing this on a patient, I would have him lay flat on their back, and every time we take it on and put it off, we have them lay down for consistency. That way we know we're operating at the correct pressures and parameters. So what I would do then is put the pump on here. After we find that pressure initially, enter our formula in. We're going to pump it up to the operating pressure that we want. And from here, the beauty of this tool is you can do any traditional exercises that you would do without the cuff on, whether it be bicep curl with the arm, just flexion of the arm forward. Works really well. You're actually seeing this utilized at every professional level, in every professional sport there is. Also at the collegiate level, every major university in the country has it now as well. They've actually started using it on pitchers after they pitch to reduce recovery time as well. They're not even having them exercise because they just got done throwing 100 pitches.
Sure.
They're putting it on for recovery purposes, as we mentioned earlier.
Wow. So kind of it's a relatively new modality that we're seeing, but definitely some great results. And we only do the cutting edge things here at Grand Island Physical Therapy. So very cool. But yeah, I can already feel that, just the.
And the beauty of this too is there's a cycle. We'll go 30 reps, 30-second rest break, 15 reps, rest break, 15 reps, rest break, and third set of 15. What makes this tough is traditionally when you're exercising and you take a rest break, it's that recovery period. Well, with this, it's still including that arterial blood flow, so you're not getting as much of that oxygen-rich blood flow to the muscle, so it doesn't get that rest break that you normally would think of.
Sure.
So a lot of guys will sit there that first time and they're used to getting that recovery phase,
Right.
and they're not really getting it as much, but that's what enables us to work you to that fatigue.
Very cool.
So-
All right. Well, thanks for coming in,
Absolutely.
Jeff, and showing us blood flow restriction. And come see Jeff and check that out if you're interested. So the Huskers this year, what do you think? I mean, what's your prediction for the record this year?
10-2.
10-2. I was gonna say the same thing.
Yeah.
I think that's might be the ceiling.
I'm hoping. I
Uh,
figure they're going to win one or two that they've shown it, but I
Right.
feel like they're going to probably lose a Purdue or Northwestern.
Yeah.
So
Yeah, I'm gonna be happy with 8-4, but no, I know like some of the national guys, they're saying 10-2. There's some legit Husker, some optimism out there.
as
so I'm
long as
excited.
Martinez stays healthy.
That's the thing.
That's
yeah,
the key, so.
that's it. Well, thanks for tuning in, and we'll see you again next time.